Appropriate renal function is vital to appropriate NOAC dosing. Renal function leads to depending on dosing of these agents, and creatinine clearance cutoffs allow us to change dosing in patients who have maybe a drop in renal function. And maybe even more so than appropriate dosing using renal function is the selection of agent. Patients' renal functions are imperative to know when selecting an agent because the renal function at baseline, or if it's fluctuating, will lead us to change an agent or to select an agent that may be less renally cleared compared to an agent that is more renally cleared. So for example, if you have a patient who has a good creatinine clearance above 95, you may want to stay away from a drug like edoxaban because those patients actually had poor outcomes in clinical trials. So knowing renal function for not only appropriate dosing of these agents and dose reductions if necessary, but also selection of agents is imperative.